Sharon Gordon here, and we just had a wonderful launch of the Start Right initiative. This is major. Joining me here is, I would say, the brainchild, the visionary, the mama for this. I'm calling you Dr. Juliet Cuthbert-Flynn because you're not acting like a minister. You're acting like a doctor who understands the importance of this. Can we talk about the Start Right project? What it means, having the butterfly IQ probe, all of it. Just share with folks about that for me.
Well, I'm not a doctor, but I'm a mother. And being a mother, I think we understand more than anyone else how important this is, how important it is for a mommy to actually, especially a young mother, adolescent mother, to really our low income mommy, to have something to start out once she becomes a mother in the hospital. And so this snuggleness is going to actually help her if it is that she doesn't, a lot of these mothers may not have a bed, they may share the bed with other siblings, and so it was important to get something like that in, and also critically to have the things, items that we're going to be putting in those baby snuggle nests for the mother to actually have that once she gets home.
What are some of the items that and this was donated by American Friends of Jamaica, right? What are some of the items that you'll find in the snuggle nest?
Well, you're going to find diapers for sure, and diapers can be very expensive. You talk about lotion, you talk about pharmaceutical stuff, you talk about thermometers. For us in Jamaica, we added the mosquito nets.
Yes,
because very important. And so mosquito nets, all the things that you can think of, baby clothes. They're those little things we want to make sure that mommies have a good start, that they have that start for them, for the baby. American Friends came on in a huge way, and as we mentioned earlier, a lot of the mothers, they do not seek care before they have the baby.
Right.
They deliver, they come in at 7 months or 6 months when there are things that's possibly happening to them and the doctors are not aware. These handheld butterfly machines are going to be very critical in what we're trying to do for our mothers in Jamaica, to make sure that they're getting the proper diagnostic care and the doctors are able to see what is happening with the mummies and the babies.
We thank you so much for your time. We at JAHJAH Foundation will be training these doctors. They're the super users, and we're going to have a lot of follow-up to do about this. Thank you so much, Minister Cuthbert-Flynn. Have a wonderful day.
Thank you.
Listen, a lot has happened this morning. The launch of Start Right, JAHJAH, having the butterfly IQ probes here. It's just so much. So let's start with you, Minister Tufton. You said it earlier, but just for our audience, just repeat. This is revolutionizing healthcare in Jamaica. We are one of the only places that have these machines on hand. Can we talk about that?
Well, as I said in my presentation, it demonstrates the importance of partnership. On our own, we would not have been able to do this. With American Friends, with JAHJAH Foundation, we are able to. And of course, the beneficiaries of this would be the hundreds, if not thousands, of Jamaicans. So we really embrace the collaboration, the partnership. And on behalf of the people of Jamaica, I say a big thank you to AFJ and JAHJAH Foundation.
Thank you so much. So I'm going to come to you now, AFJ. Wendy, Hart, you said something that was so important about partnership, and Dr. Tufton is repeating that. But even more important, it's the accessibility that you're bringing to so many Jamaicans.
Obviously partnership is what we try to work with on so many of our grants, but what we're so excited about with this project is what it means for global health. I think butterfly and handheld ultrasounds are really transformative to global health because, this is a challenge the ministry has dealt with so much. You get a big machine, it breaks down, you can't get the parts, just trying to figure out getting the manufacturer to send their person down to fix it. These are items that don't have a part. When I asked Dr. Dixon about it, it doesn't break down, so it mightn't,
You have to bring it back to the manufacturer, you just put it in a box and send it back to the manufacturer.
Yeah, we're talking about a completely different thing. And it's really transformative because for many people, if it's broken in the hospital, then they get sent to a private clinic. No, the healthcare system doesn't support them. So now they'll be able to have their scans right in the hospital. It's really about transformation for patients and healthcare professionals.
So we're way out front. Dr. Dixon, talk about the training that you provide.
Well, I brought a team down here from Jacobi Medical Center in the Bronx, New York, and they're volunteers. They work with me daily in the emergency room. Wendy was able to see some of our Zoom that we're all in this together. So it's great when we can bring them down. These guys don't ask for much. And we work with Wendy and American Friends of Jamaica. We work with Jamaica's Ministry of Health to make this possible. I mean, the volunteers is just what makes this happen. If everyone worked on a 9-to-5 schedule, this wouldn't happen. There's a lot of time that went into this. Wendy texts me 5 o'clock in the morning, and I text her back at 5 a.m. because that's what it works. Collaboration, it goes a long way.
So I think that this is a good way to wrap up. You quoted Dennis Brown in your speech, and no man is an island, no man stands alone, right? Each one as your brother. And this is what this is. So I just want to thank you all for this partnership, collaboration, and I look forward to how we're going to transform lives in Jamaica with this Butterfly, IQ Probe, Start Right, JAHJAH. Thank you all. Thank you.
Thank you very much.
I'm here with Laura Tanner. She sits on the board of directors.
I'm a director of the American Friends of Jamaica.
Thank you for being here.
Yeah, well,
But
thank
you're
you.
other things too.
Oh.
I've been told.
Well-
Author and a whole bunch of things.
The government of Jamaica was kind enough to give me an order of distinction for my work with distinction in art and literature and culture. That was for the Jamaican folktales and oral histories. I did my research on the African heritage in Jamaica, and then Jamaica's master potter. And I also worked on a memoir with one of our former ambassadors, Sumacourt.
So
Cobb.
So
and that
you
was,
really sit well on the American Friends of Jamaica because you are indeed
I am.
an American friend of Jamaica.
We have. Well, I'm an American. Every director of the American Friends of Jamaica has to be an American citizen.
Okay.
And this is why it's very important to us that Wendy Hart, for instance, her father was like Mr. Montego Bay. He was seventh generation Jamaican, and it's great that she, as an American and a Jamaican, can be, the president of this organization. I'm chair of the grants committee, and our deadline is February 3rd for people who are applying for grants, health, education, and development. This organization was founded 40 years ago. 40 years ago. I have an article actually in Jamaica Pegasus magazine in celebration, giving the history of that, because it was one of the former ambassadors who was very instrumental, and for 17 years, Glenn Holden, he served as the president of AFJ, and he really kept it going. It was originally something that started with Ann Sabo, and when Eddie Seaga was trying to raise funds to help Tivoli, and then it went into something much larger.
And here we have the Butterfly IQ Probe, we have the Snuggle Nest coming.
That probe. I think these volunteers over here we're allowing to be demonstrated upon, I think they're very brave, but it does show what you can do with a handheld instrument, and it's very important. We're only starting with, I think, 20 of these, but the country could use so many more. This is why we're having a gala on March 11th in Miami, and we really tell your friends, the diaspora, about it, because that's where we raise our funds. People make contributions at the gala there and the one in New York in the fall.
And the one in New York, well, we got 24 from you.
Oh,
So
24, that's even better.
So we'd like to get 24 more.
That's
so
what
go
I'm
to
hoping.
the galas, please.
Please,
And
seriously.
support.
It's, if you want it, it's theafj.com. You can look it up and Google it, but you have to put theafj.com, and it's really very important.
Thank you so much, Laura Tanner. Thanks for your time and thanks for your work.
Can I also give you a plug? Alexandra Clark, who is Oliver Clark's daughter, and Monica. She has just joined us as the program analyst. So she's the one who's going to be going on site visits and, residing here and looking at what we're doing to make sure that the grants are spent well.
Absolutely.
We only give
where it should go,
exactly,
and
that's
for what it should be.
precisely. That's the important thing, that
Yes.
the AFJ delivers on
Yes.
respectable and
The
responsible.
integrity of the organization is really based on the integrity of how its funds are being distributed.
You said it very well.
Thank you very much.
Thank you.
I appreciate you.
Well,
Have a
we
great
appreciate
one.
JAHJAH.
All right.
Yeah.
JAHJAH. You said that so nice. Say it again. We appreciate
JAHJAH.
Oh, I love it. I love it.
This is Alexandra Clark, who is the program analyst for the American Friends of Jamaica. She's just been appointed. We're very proud of that. And as you were saying, you work for the Gleaner.
I worked for the Gleaner in North America for many years. And when your dad would come up for these major events that would happen, whether with Jay and whatever, yeah, I used to have to do those interviews.
What a funny
Yeah,
coincidence.
very nice to see you as
World
well.
is small.
And this is on tape, so everybody's hearing this. All right, so I'm Sharon Gordon. I'm with JAHJAH Foundation, and you know,
Laura Tanner
Lauren
here is-
Tanner was just
I
telling
just
us
said.
about you, so we turned around and there you were. Just talk to us real quickly about how you feel about this work, with the IQ probes, the butterfly IQ probes, the snuggle necks, start right, all of it.
I think it's a great example of a public and private partnership. American Friends of Jamaica, one of our pillars of focus is health. So it's really, really great in all of the instances where we're able to partner with the government to have these kind of great initiatives, and it's lovely to kind of see all of the support from the diaspora, both through the JAHJAH Foundation and through the American Friends of Jamaica, and including people who are not here in kind of improving our healthcare system locally, and supporting Jamaicans and bringing that back. And I think this is a great example of that, and it is so amazing to kind of see all of this come to fruition, and I know all of these number of people have had such a have put in so much time and effort to this, and it's just beautiful to see it kind of all come to fruition.
Well, you know, I can't add anything to that, right? How wonderful, right? You literally just encapsulated everything that we literally were just talking about, and how we thank you and congratulations on your new role.
Thank you so
And I look
much.
forward to chatting with you both the next time
Yes,
we get
for
together for the
sure.
next 24
Yeah, exactly.
butterfly IQ
That's
probes
right.
and the next 1,000. Notice I said 1,000 snuggle nests. We need those snuggle nests.
Yeah.
That's a whole nother conversation. that
excited
we
to
could
see where
have.
all of this
So
goes.
exciting. We're changing, revolutionizing healthcare in Jamaica.
For
It's
sure.
major.
And I
For
think
sure.
we have to really thank the Minister and the
Yes.
Minister of State.
Yes.
I mean, they are working very hard.
Yes. Thank you for putting that in. Thank you both. Have a wonderful day, and we'll talk soon. I am here with Claudette Powell. She is
At this affair, I am a volunteer of JAHJAH, that's number one. And I also chair the Jamaica Diaspora Health Sector in the Northeast USA.
and that's why I paused and allowed her to introduce herself, because she
Yes.
wears many hats.
Yes.
Now, the hat you're wearing today has to do with your volunteering for JAHJAH, but even more importantly, you're very
For the health sector overall,
Right, right. Why
yes.
don't you talk a little bit about that?
Well, the Northeast Jamaica Diaspora is comprised of volunteers, mainly in the health field, but you don't have to be in health. And of course, I have to say JAHJAH is one of our primary groups in the Northeast, and one of 200 missions that is coming to Jamaica. And I am so pleased that I could be a member of any group, but for some reason I'm here with JAHJAH, and I'm very pleased to see what JAHJAH has been doing. Today's event is another of those, where they're having the Ultrasound Conference and also the Start Right program. Just saw the unveiling of the Start Right program, the maternal child health.
You wanted to talk about partnership and collaboration and how the diaspora works with folks on the ground in Jamaica. Do you want to say some more about that?
Yes, and most of the time when I do a presentation, I encourage persons to collaborate and partner. And this is a true partnership. As Dr. Dixon said earlier, you cannot stand alone.
No man is an island.
No man is an island. And the nicer part about this is also a partnership with the Friends of Jamaica. Because, you know, although we talk a lot about the diaspora, we can't forget Friends of Jamaica. And so this is a point for others to look on and say, hey, don't stay in your own corner and think everybody's going to steal your show. If you feel that way, you're not going to get any help.
Well,
And
you're
this is a
absolutely
success
right.
story.
All right, well, it's a success story.
Yes.
Thank you for that. Claudette Powell, y'all. Hanging out, getting it done right here.
Yes.
JAHJAH Foundation volunteer is the hat she's wearing today. Thank you so much, Claudette.
Thank you very much.
Hi, I'm here with Dr. Sonia Copeland, and she has just been, I didn't even realize that your title has now changed. Why don't you share with everyone now this title of yours?
Okay.
Because it's so wonderful that you're still doing all that you do.
You know, once you have worked in the public health sector, it remains with you for life, I think. It's not something that you say you're just gonna take on a new persona. And so my passion for public health after 32 years working with the Ministry of Health and the different hospitals and in health centers That passion is still burning in me. So while at the Ministry of Health, they had asked me to work with some of the diaspora groups. And it started with the Organization for Strategic Development in Jamaica, and then the OID, but with JAHJAH Foundation, Jamaicans Abroad Helping Jamaicans at Home. I feel like we need to say what the acronym is every time.
Absolutely.
Yeah. It became personal.
Yes, it did.
Because Dr. Trevor Dixon, the founder, I met him when he was only 8 years old. And my mom and I took him to the States because he was migrating to be with his mom and dad and sisters. And I followed Dr. Trevor Dixon's career, and this passion that he still has for Jamaica touched me deeply, really,
She's
really
talking
deeply.
about you, so you might as well walk into the frame.
Yes.
Because we're about to cry. All of us here about to
We
cry.
were about to cry, yes. He left Jamaica at 8 years old and, migrated, but retained this passion for Jamaica because of his grandma, And he did work with the Percy Jr. Hospital, and I said, he's for real, and kept me abreast with everything. Our mothers were best friends. And so I said, whatever he is doing, because I know the landscape, I will facilitate his work here. So he's not just with health, he's also with the educational sector as well, and just community development, I really, really am proud of him and his entire team, and we are showing that, yes, the diaspora is at work and doing good things.
Well, we thank you for that, Dr. Sonia Copeland, but you are someone we're very proud of, and your new title is?
Okay, so I'm retired, but I am
So she says.
For the Compassionate Fund.
I want you to hear that. That's why I wanted her to say it. Do you hear what she's the chair of?
The Compassionate Fund.
What is the Compassionate
It's an
Fund?
initiative between the Ministry of Health and the National Health Fund to offer financial assistance to persons who are in need of diagnostics and services that are not readily available in the public sector. We can never have enough stations for dialysis, so we help with that as well. So it's at the heart of what I want to do for my country, and so I'm very happy to be doing that.
And that's why we had to get her on camera. Dr. Sonia Copeland is living proof of what compassion is. Yes. And here is Dr. Dixon. She took him on a plane, 8 years old.
You know what? I came to this ceremony today, and I was on the elevator and said, wow. My father passed away last year, and I said, it's the first time I'm going to give a presentation, and I'm not emotional about it because this is a happy moment and everything else. And sure enough, I hear Sonia starts to talk about my mother.
My grandmother. And it does it every time.
Yeah.
I said before Dr. Dixon walked over that Sonia was going to get us all teary-eyed because I know that people see Dr. Dixon, they see all of us here, and they hear JAHJAH. And you're right, Dr. Copeland. We must tell them that Dr. Dixon was blessed. This was a vision. Jamaicans abroad helping Jamaicans at home. JAHJAH. We represent that. And so when you see him getting emotional, and I was getting emotional, and you see Dr. Copeland getting emotional, and Garvin is behind the camera and is probably teary too, it's because this work is not being done for profit, okay? Understand that we love Jamaica. We love our people. And you see, he became a doctor. Look at his role model.
Yeah.
Do you understand? If you know his mom and his dad and his grandparents, you know the family, you will understand. So understand that when you support JAHJAH Foundation, it is a compassionate act that you're engaging in. And you're supporting the Compassionate Fund.
Yes.
And you're supporting all this innovation because we are revolutionizing healthcare in Jamaica. This brethren, and I'm speaking in Jamaican parlance now,
Yes, man.
this brethren
Yeah,
you see
man.
right here, so is a really hard man.
That's really
You understand?
yes.
Him not about no doctorship and no this. He's about helping and caring and making sure that the least amongst us can also be given full access.
Yeah, I just
to
want to say
healthcare.
I'm nothing more than a kid from East Flatbush, Brooklyn. I mean, I was born in Christian in Manchester, migrated to the States, as she brought me up when I came to the States, and I didn't know I was staying, and that was very traumatic for me, as you know. Right? But I'm just a kid from East Flatbush, Brooklyn,
Yeah, man.
and early on I realized that God was going to use me in a different way. When path was just being cleared for me, so I said, you know what, God, you really going to do this for me?
Yeah.
And He said, yeah.
Yeah.
He said, but
Yeah.
don't forget
Yeah.
why I'm doing this.
Yes,
And I try to stay true to that. And that's why we call it JAHJAH Foundation.
Right, yes. I think I want to honor the memory of his mom, a nurse in Brooklyn.
St. Luke's Roosevelt in Manhattan.
Right, yes, we just want to honor her memory as well.
Legendary.
Legendary, yes. Hazel Dixon, yes, yeah. The late Hazel Dixon. How many years? Perhaps about 40 years in
Almost,
nursing.
right?
Yeah. Uh-huh.
She was a nurse in England, and then she came to America, became a nurse also.
Yes, uh-huh.
It's what these Jamaicans do.
Yes.
You know that?
Yes.
That's what we do.
That's what we do, yes.
I want to thank you both.
Yes,
Thank
you're
you so
welcome.
much.
Thank you.
All right. We're here. We are at the 15th annual conference, and I think, Courtney Cephas, we have just gotten 2 minutes with you, if you don't mind.
No,
And I'm going to let you say your title, but I did get it right.
No, you did.
I did.
You
They
did.
tried.
You
They tried to
did.
blow up my
Courtney
spot.
Cephas, Executive Director, National Healthcare Enhancement Foundation. And I just wanted to say how grateful, how thankful we are for the support of AFJ, JAHJAH Foundation, and all the other team members behind making this happen. We are blessed. And the Ministry and the Foundation, National Healthcare Enhancement Foundation, is so glad and happy to have the support. Both AFJ and JAHJAH, long-standing donors and supporters of the ministry, the health sector in Jamaica, and that partnership is always great. And we look forward to a lot more support from them in what they do.
And especially with this new role and this new department that, I don't know if you want to talk real quickly about it. I know time is of the essence, but if you could, this is major. What's ready to happen.
The good thing that folks should know is that our support and our ability to facilitate donation and facilitate the diaspora and make things better is going to increase tremendously, because we are so much more funded now and resources are coming on board. And so there is no reason why we should not do things much bigger and better, and the partnership should be greater. And we're looking to reach out more and build that partnership, because it takes people, it takes individuals. So with the team behind us going forward, we should be able to provide a greater support both to diaspora and to the contributions that they want to the Ministry of Health and to the people of Jamaica.
Well said.
Yeah.
Courtney Cephas, is him that?
No, your energy is just too much. We love it.
Love you. Thank you so much.